Joining us now is California Congressman Khanna, member of the Affordable Drug Pricing Task Force. Congressman, good to see you. Thank you. Got a big smile on your face about this because this is a simple matter that to most people should have been sorted out more than 2 decades ago. The idea that Medicare is allowed to negotiate for the price of the drugs. They're not free drugs. Nobody's getting it free. No one's forcing anybody to sell anything, and the government's not taking over the manufacture of anything. This is the right to negotiate because you're a bulk buyer.
Absolutely, Ali. And for all of the Republican rhetoric on inflation, this administration is actually taking action to save Americans money. Here's what it's going to mean for the 10 most expensive drugs, for drugs to tackle diabetes, blood thinners. Americans now are going to pay less. There's a cap of $2,000 a year on their out-of-pocket costs. And, by the way, this is going to reduce the deficit. All of the Republican rhetoric on deficits, they haven't done anything. This president has, because Medicare is about $800 billion of spending. Of that, 20% is pharmaceutical expenditure. It's out of control. The pharmaceutical industry has made billions of dollars of profits, most of it on stock buybacks, Ali. By the way, they're spending more on stock buybacks in the last 10 years than on research and development. So it's a red herring that this money is going to innovation. And this president is lowering the costs, lowering the deficits, helping the American public. He's delivering.
So you make an interesting point. This is not just possibly and ultimately a saving to people who buy and use those drugs. If I use none of those drugs, the saving to me is part of the taxpayer saving, right? The $50 billion plus over 10 years. And that's at a minimum because that's just the beginning of this list. That's the starting gate for negotiations.
Absolutely. Look, from Paul Ryan, the Republicans have been railing against the cost of Medicare, the cost of deficits. They've done nothing about it. Joe Biden is the first president who says, OK, let's reduce the cost of Medicare. You know how you reduce the cost? You go after the excessive fees. One of the excessive costs is pharmaceuticals. They're making billions of dollars of profits. It's going into stock buybacks and shareholders. The American people are getting fleeced. And President Biden is saying, no, we're going to stop it. We're going to negotiate. We're going to have Americans pay the same price as places other countries around the world pay. And you know who was for this, actually? Donald Trump. What's the difference? Yes. Joe Biden actually delivered what Donald Trump was talking about.
It's interesting. In the entire Trump administration, there were a few ideas that he had. They were like, are you going to do something about that? And this was one of the ones he didn't do anything about. The drug companies don't like this idea. They don't have the ability to say outright they're not going to participate because there are penalties. If a drug maker doesn't negotiate, doesn't participate in good faith in the negotiations, they may have to withdraw all of their drugs from Medicare. Doesn't mean they can't sell them. They can sell it in the open market. But if you want to sell through Medicare, you're going to have to negotiate.
You know what galls me about the big drug companies? They spent $370 million, Ali, on lobbying. There were more lobbyists in Congress than there were Congress people, and they still failed to kill this legislation. The democratic process worked. They tried their hardest to stop the democratic process, and now they're complaining after their lobbyists failed for legislation that's simply saying that the government wants to negotiate for a fair price for the American people so that they can't rip off the American people, add to our deficits, and enrich their stockholders. This is why people are so frustrated with the rigged economy. Exhibit A is Big Pharma. And this president has had the guts to take them on. And when he gets 4 more years, he's going to expand the number of drugs and actually tackle inflation and actually tackle our deficit.
So here's the interesting thing. In most of the world where there is a level of universality of health care, which just doesn't exist in America. America is the only developed country that doesn't actually have certain levels of universality across health care. In many of those countries, it was brought in by conservatives, not by liberals, because it's just more economically efficient. We got Nikki Haley out there calling this communism. We've got Cathy McMorris Rodgers calling it socialist price setting. Clear this up for us. Nobody's price setting anything. There's no communism because the government is not controlling anything. It's a negotiation. The same way if you buy lots of paper for your office, you negotiate a price.
Absolutely. This is just the government, which is a large volume buyer, saying, give me a good deal. It's we do this all the time in how we buy things as consumers. But the more important point, Ali, is the healthcare costs are 20% of our GDP. It's killing us. It's killing working people's wages. It's making it harder to manufacture here. And it's pro-economic growth to actually reduce these costs and give everyone health care, and to be for Medicare for all, which I have supported. I actually think that's good economic policy.
It is good economic policy. You're absolutely right about that. Thank you, sir. Good to see you. As always, Congressman Khanna.